The holiday season is upon us. That means shopping in busy malls, work parties, and family gatherings. Health officials are seeing a spike in reported influenza cases across the country. According to Manitoba's respiratory virus surveillance report, 29 people with the flu were admitted to hospital, 3 in the intensive care unit, and 1 person died last month from November 16th to the 22nd. Joining us now with important reminders on how to protect ourselves and our loved ones this season is Chief Provincial Public Health Officer, Dr. Brent Roussin. Good morning, Dr. Roussin.
Good morning.
Thank you so much for joining us. Now, we know that we're seeing some numbers. What are we seeing in terms of, we know the numbers are going up across the country. What are we seeing here at home?
Yeah, so we are seeing now significant influenza activity. So last few weeks, we've been seeing a consistently increasing numbers, increasing test positivity for influenza. And that's influenza A, the H3N2 is the predominant subtype that we're seeing now.
Okay, and then there's one in Australia that was causing some trouble. It's the subclade K, right?
That's right, yeah, subclade K, and that's also what we're seeing here at this point. And so we know we've heard of reports of potentially, increase in severity with this, potential not as great a match with a vaccine. Okay. But every year we don't know the exact match until later on in the season. So, still this doesn't change our messaging. Our best protection against influenza is getting that vaccine.
Now let's talk about influenza and why it is so dangerous.
So this is a respiratory virus. It's easily transmitted when people cough or sneeze or just in close contact with somebody who is ill, and can cause quite a severe respiratory illness with secondary complications. Those at most risk are those over 65, those under 5, and then of course those with underlying medical conditions. So every year when we see hospitalizations in ICU, those are the type of individuals that we see in the ICU are people with poorly controlled chronic diseases and unvaccinated.
Okay, and it could be deadly.
Absolutely, well. we see influenza deaths every single year.
Okay, what about COVID numbers? What are we seeing with that?
Yeah, and so COVID, we see that it still hasn't declared itself as a seasonal virus. We see it spread throughout the year, and we see high numbers even throughout summer and early fall. As we're starting to see influenza numbers pick up, we're seeing a small decline in COVID numbers, but it's still causing significant issues. And again, those at high risk, those over 65 and underlying medical conditions, highly recommend getting that vaccine this fall.
What about RSV?
So RSV a little early, not seeing a lot of transmission at this point, but we know that always plays a significant role, especially with the younger population.
Okay, so we're gathering with our families real soon. The holidays are upon us, hanging out with coworkers for holiday parties as well. What messaging do you have for the public?
Right, and so every year we see significant impacts on individuals, on families, on the healthcare system with respiratory virus season, and so it's upon us to really protect ourselves. So one is that vaccine. Anyone who's eligible to receive that vaccine for both COVID and influenza, we highly recommend it. And then the messaging that is. We've all come used to here, right? Stay home if you're really ill, hand washing, coughing into the sleeves, and really can protect ourselves and the people around us.
Are you seeing an uptick in vaccination rates, or is it dropping?
Well, vaccine rates for influenza is fairly stable. We're very similar to this time last year. This time last year for COVID, fairly stable as well. But certainly the COVID vaccine has dropped significantly since the height of the pandemic.
Okay, so let's talk about measles, because measles is also something that's spreading in our communities, and people will be gathering, and that is also a risk. What reminders do you have about that?
So measles is the best example of how effective vaccines are for this, and so we see measles now spreading over 6 months in the province, approaching 280 cases, but we see the predominant spread in areas that have lower vaccine rates. We're not seeing it in areas with good vaccine uptake, and that's just as another example of how effective this vaccine is. So same thing, those who are eligible to be vaccinated, we highly recommend that. People who are ill, showing any symptoms of measles, that high fever, the cough, that rash, please get tested. Please see a healthcare provider, or at the very least, stay home if you're not that ill.
Okay, Dr. Roussin, thanks for your time today.
Thanks very much.